So I'm here with Alison Chapman today, who's the Designated Nurse and Safeguarding Lead at Oxfordshire CCG and member of the Association of Child Protection Professionals, to talk a bit about her work in child protection. So thanks for talking to us today, Alison.
Okay.
I wondered if you could tell us a bit about an average day in your job.
I think the first thing to say is there is no average day. Every day has got its own different quirks and challenges and excitement. I would probably have to say that every day involves at least one or more conversation with one of the partners in the safeguarding world, so either the police or with social workers or with another health professional or with another area. So there's always going to be some sort of connections and some sort of coordination or communications across different partners and boundaries, which makes it quite interesting. So that's probably the only thing that I can say happens in a daily basis. Other than that, a mixture of trying to actually look at how we're doing the work that we need to be doing, how well we're doing it, what we're doing, from different lenses and different perspectives. So I go out and meet lots of different groups of people, investigate and think about what they're doing, how they're doing it, and then looking at cases and case studies and case reviews to see the ways that we work through different lenses. So I think that's probably a summary of the sorts of things that go on a daily basis.
Thank you. So how did you get into this role? What made you decide to go into child protection work?
I don't think you ever decide to go into child protection work. Most people I speak to have ended up in child protection because of the range of other work that they've been doing. I was actually a children's nurse in an acute trust, and I was working within the neurosciences team and neurosciences department. Became part of the university lecturing team part-time as well. So I had a job role that was a lecturer practitioner post, and within that was doing a lot of the clinical skills training and a lot of the different partnership training that was going on within the programme. Child protection being part of that, because I was doing the child protection training within the university setting. The then named nurse for child protection in the acute trust asked me to help her out with the training in the trust, and then when she retired had effectively given me all of her workload and passed it through. So I came through the acute trust and working in the children's hospital in Oxford as a child protection nurse there, and then came out into the community and worked in the community setting for a short while before moving from provider organisation into the clinical commissioning group as the designated nurse when that post became vacant. So became interested in it because of the head injury work that we were doing and the children we were seeing in the various neurosciences settings, where there was mainly the trauma, but also the complex care needs of children that were leading to some challenges for families.
And we hear a lot about those. I mean, the work is by definition quite sad in many ways, quite traumatic, and we hear often just the bad news stories about child protection when things have gone wrong and something awful has happened. So I just wondered today, in terms of presenting a more holistic picture, whether you could maybe tell us a bit about something positive that's happened in your career, what you say would have been the highlight or the most uplifting thing that's happened.
I think one of the nicest things that I've seen probably fairly recently, there's a number over the years, but the one that sticks in my mind is we've got a young person who has actually been part of the Looked After Children team. Her family were very complex. She had child protection and child in need type plans from probably around the age of 5 or 6. Still works in the teams that we are working with, and she's doing an apprenticeship alongside carers and care support workers. So she's become part of the team, having gone through the system, and she's been a fabulous, really energising and really inspiring person to know and to actually have worked with. And it's been a real privilege to have actually helped and seen her progress as she's changed and had some really, really tough times, but she's so good about the way she manages all of those tough times, that she's helping other people now to actually achieve those goals, which is really lovely. And she's currently working as an ambassador for other children in the system. So I think that's probably a really story and a nice situation I still see. So when I see her, it still makes me smile.
That's a wonderful story, thank you. But I guess on the flip side, we know that it's challenging times and difficult for people across the public sector working. So what are some of the challenges that you're facing in your context?
I think they're many and varied, if I'm honest. I think one of the biggest ones is the difficulty that frontline staff are currently having with being able to take a step back and actually reflect on how they could do something differently. We're all being told we need to do more. We're always being told that there is less available to do the more with. So there's actually a point in time when you have to actually step back and step away. I'm really lucky in the designated role that I do have a little bit of reflective time. I have an opportunity to actually see how people are doing what they're doing, but actually giving practitioners the space and actually to contribute to trying to think differently and react differently is really difficult when pressures are so high, and expectations of everyone on those practitioners is really, really high. Workloads are increasing. We've got increasing numbers of children on protection plans, we've got increasing numbers of children in the looked after system, and there is no additional resources coming forwards to support the practitioners in changing the way they do what they do. There needs to be a little bit of that. We're at the point where there is no flexibility in the system. Everyone is working flat out, and that really is quite challenging to help make it better for children that are going through the system.
Yeah, that is certainly something that we hear elsewhere from others as well. And one of the key concerns that members have raised has been that, you know, that in that system where there's no flexibility, they will possibly miss something, and that's the thing that keeps people awake at night. Yeah. But if resources weren't an issue, what's the thing that you would change or like to see changed to improve the lives and safety of children?
Well, I think I'm going to be slightly controversial in that I'm not convinced that resources are the only and the key issue. I think the problem we've got is because people are working flat out, we can't actually break down the barriers that mean that we can share resources better. So the local authority are really, really struggling with the numbers that they're working with, and they're really struggling with the workloads they've got. Health visitors, school nurses doing the same thing. But I still think there's possibly some overlaps of what we're doing and how we're doing it, but we're not in a position to yet break down those barriers and work differently because we're affiliated to different organisations. And we have the same thing within primary care. Primary care is a really good example of a service where there is so much that's being requested and asked of them. Remembering to do all the different things that they have to do is quite difficult, but they're actually feeling quite isolated because they're not integrated into the other parts of the health system. So the changes that are happening within the NHS and the expectations from the 10-year plan about moving to primary care networks and integrated systems is a step in the right direction, but it's a step that's only happening from one perspective. It's not being echoed from the local authority guidance documents or from the police guidance documents and the other services that are critical and key in child protection work. So until we've actually worked through how we go across those barriers, how we actually have an information system which is a public services information system, rather than all the different types of records that we hold, all the different information, I think we're going to struggle. So I think my goal would be, the first thing I would really want people to work on is thinking, and in my ideal, is we would have a structure where we didn't have the barriers to a joint information system that allows us to actually then work across those boundaries and parts of the system. So we have adults that have mental health problems, and we have children that are in those households we know are struggling, but we don't have the capacity in many instances where the health visitors and the adult mental health workers are sharing the same information. They have different records, different systems, and different parts of systems. So it's a real, I think we could make our work a lot easier and a lot more streamlined if we did that. So although resources are really difficult, I think the way we use the resources is creating as much problem as anything else.
That's interesting, because I think creating genuine, joined up, coherent multi-agency working is absolutely key in this field. And it's interesting to hear you talk about how it plays out even within the health service, as opposed to between the health service and police and social work. So yeah, plenty of food for thought.
Well, I think just to add to that, I think the move of health visiting school nurses into public health and public health into the local authority, in a way, is a step for them in the right direction, but they're not integrated with children's services. Even in the local, gone across to local authorities, they're still separate directorates. So there's just this artificial separation, or not, it's not even artificial. There is a separation that exists, which is making it more complex, I think.
So it's about how do we put the child and the family and their needs back at the centre of that service provision, rather than
and actually
structurally driven.
Provide a pathway provision rather than a organisationally led provision. Might be as a way forward.
Great. Okay. So if somebody was just starting out in your career path, or aspiring to a career working in child protection, what would you say to them? What do you wish you'd known, perhaps, at the start?
I think I would encourage somebody to do that if they really like working with a very wide range of people, and that they are inquisitive and actually quite nosy. You have to. The curiosity does mean you have to ask the questions, but you also have to be able to stand up. You've got to actually be quite a strong person and stand up, even sometimes to senior people, more senior than yourself. So you've got to have quite a lot of self-confidence, self-belief, and you build that through having really strong networks of colleagues and peers. But also through the knowledge that you gain. So you have to work really hard to keep up to date with the knowledge and skills that you've got. So being able to actually see documents, so as a learning skills that you need, those sorts of things. That's probably what I'd advise somebody. But I certainly wouldn't stop anyone doing it. I love the fact that we are trying to work across those boundaries and create better spaces. So it's a good place to be, I think.
That's fantastic and reassuring to hear. I mean, I think that we all do, and you all do an amazing job at making a difference for children, and there are improvements over time. We can see that in the trends in the data. So despite the scare stories, it's a fantastic field to go into, but challenging work. Thanks ever so much for talking to us today, Alison. It's been really interesting insight into your life and your role. So we hope that it will be useful to other people to see what that's really like.
Thank you.
Thanks.